In Quebec, October 15th will be known as Perinatal Bereavement Awareness Day or Pregnancy and Infant Loss Awareness Day. And it's all thanks to Liberal MNA Désirée McGraw. Thank you so much for joining us.
Thank you for having me.
So you tabled the bill. Tell us why this is so close to your hearts.
Yes, so I myself have had experience with perinatal loss, both 5 miscarriages, and then in addition to that, a stillborn daughter, Catherine. So for our family, myself, my husband, and our 3 sons, so I'm very grateful for that. We feel this is Catherine's law, but really it's a law for all of those families, those 23,000 Quebec families a year, in honor of their loved ones, their little ones who are lost forever. And so it's based on a personal experience, and I wanted to, raise awareness about this and destigmatize a complex loss. And frankly, since then, I've heard from so many people across Quebec, both in my riding across Quebec and even across Canada, of people near and far sharing their own stories and their own family, either growing up or their own families that they're creating now. And so it is not an uncommon experience, but unfortunately it's not really talked about. People don't necessarily know how to talk about it. So hopefully we've opened a space where people can be seen and heard and feel supported.
The bill passed unanimously in the National Assembly last Thursday. Take us back to that moment. What was going through your mind?
To be honest, I was unprepared for the level of support. To have your colleagues, not just in your caucus, but the entire National Assembly, every single MPA standing up, voting yes. And then there was a standing ovation. And then I know that politics is often an extreme sport, and people often see the cut and thrust of it, but this was really such a special moment for me, and I hope for others to see that we can really come together around our shared humanity, put aside partisanship, and stand strong together.
And what should Quebec residents expect with this bill, and what would you like to see moving forward?
There's a lot of concrete steps we need to do to support parents. For example, if one has a miscarriage before 20 weeks, you're expected back at work the next day. So we need benefits to support mothers. We also need benefits to support fathers who have experienced perinatal loss through the whole process, whether it be, earlier in the pregnancy, later, or of course after birth. So that perinatal means around la naissance, around the birth. So it can be before, during, or after. So we need greater supports, but also the healthcare system. I know that when I was in the hospital and delivering Catherine, I had to deliver her. I could see some of the nurses were just, I didn't sign up for the maternity ward. So we also need to support healthcare workers. Raise education around this, and so the benefits for the parents, the support in the system. We need more research on this because it is a complex form of grief. And I'm looking forward to continuing to work with other parties and experts and stakeholders and families to move this forward, to make sure that we adopt legislation that is informed and informed by the realities of families here in Quebec.
Thank you so much for joining us.
Ahead on City News.